hide the screen or not?
I think it's fine if you leave
Yeah.
it there.
Okay. Perfect. Thank you so much.
Hello, everyone. Welcome to today's webinar on health and medicine's information management during the COVID-19 pandemic. Thank you for joining us. This webinar is organized by interns of the Pharmacy Education Committee. This includes Lamis Khalid, Trisha Dogra, and myself, Mario Keo. Our work was overseen by our team mentor, Lanre Papula. At the end of this webinar, Lamis will be coordinating a question and answer session, so make sure to ask any questions you have using the chat function. Trisha will be sending a webinar feedback form now, and during the Q&A, please make sure to fill this out as your feedback is very important and valuable to us. It should only take a minute or two to fill out. Finally, the webinar is being recorded and will be made available for you on the YouTube channel of the International Pharmaceutical Students Federation. First, we would like to introduce the International Pharmaceutical Students Federation, which can also be abbreviated as IPSF. The IPSF is the leading international advocacy organization for pharmacy and pharmaceutical students and recent graduates. The IPSF was founded in London in 1949 by 8 pharmacy student associations, The Federation now represents approximately 500,000 pharmacy students and recent graduates in 92 countries worldwide. It is the oldest faculty-based international student organization in the world. There are 5 regional offices of the Federation: the Asia-Pacific Regional Office, the African Regional Office, the Eastern Mediterranean Regional Office, the European Regional Office, and finally, the Pan-American Regional Office. These regional offices comprise 117 worldwide student associations collectively. The IPSF's vision is to improve public health by advancing pharmacy practice and serving as the global collective voice for pharmacy and pharmaceutical science students and recent graduates. The IPSF works to achieve this vision through its 3 portfolios: public health, pharmacy education, and professional development. All of this work is done whilst withholding the IPSF values, which include respect for human dignity, cultural diversity and individualism, a team spirit that encourages individual initiative, and delivery of quality-driven outcomes. Now I'd like to introduce our speaker, Professor Victoria Hall. She is the Dean of the Faculty of Pharmacy in the University of Costa Rica. Professor Hall has many years of experience in health and medicines information. She has served as the head of the National Drug Information Center with the faculty.
Hi, hello. I think I have a problem with the microphone. Could you please let me know if you're hearing me?
You're mute. You're mute. Yeah, now we can hear you.
Yeah?
Yeah.
Okay, so now you can start, right?
Yeah.
Perfect. Well, thank you for all of you for being here. And for me, it's an honor to be here and to share with you some of the information we have at the National Drug Information Center and also around the world. Let's see if we can pass. Yeah, I would like to thank the International Pharmaceutical Students Federation, IPSF, of course, for the organization of this webinar. Also, my home, Information Center, CIMER of Costa Rica. And I would like to thank the pharmacy, the students, and all the administrative staff that helped me with this presentation. And of course, the Pharmaceutical Research Institute of the Faculty of Pharmacy at the University of Costa Rica. So thanks a lot for this opportunity. And I would like to give you the overview of the presentation. We're going to talk a little bit about medicine and drug information, about pharmaceutical care and the information resources we have available. We're going to talk a little bit about the COVID-19 pandemic, some of the information, the web information we have, and the role of the Drug Information Center. And finally, we're going to have a little presentation of the experience we have in our National Drug Information Center. Okay, so as you can see in this slide, the pharmaceutical care has many definitions. In fact, the WHO has given a definition in the Tokyo report. Then in United States and in Europe, we have different meanings, but all of them involve the activities made by pharmacists for the patients. And in this kind of activities, we can mention the dispensing, the pharmaceutical consulting, the medication therapy management, also known as therapeutic follow-up, the pharmacovigilance, education, medicine and health information, that is a topic that gave us today right here, and pharmaceutical compounding. So health and medicine information, you know, there's a lot of resources, and I think one of the main topics that got influence in this kind of work is, for example, the changes in epidemiological profile of the countries or even the world. Right now, it is the best example with the COVID-19. Also, the quantity and the quality of medicines. I mean, not all the countries have good regulations about that, about the quality. And as the years go by, we have more and more options of treatment. Also, the fake news, the resources available, because you have to pay some of them, other ones are for free. The quality of this information, because we want the information to be totally clear, with no conflict of interest. And of course, the patients also may experience lack of trust in health professionals, including the pharmacists. So these kind of topics make the health information and the medicine information more and more important every day, so we can counsel the patients. Depending of the country you are, and depending of the country you look up for information of medicines, you can use, for example, some books or ebooks like the Martindale, the HFS. One is about pregnancy and lactation of this author, Briggs. The British Formulary, Up to Date, Clinical Key, Micromedics, the Remington, the national formulary of each country, of course, the FDA and the EMA, some databases like PubMed, and of course the articles. But not everyone has the time to go around every information sources to make their own opinion and to have the real information to make decisions in health. So right now, all the information, we have it on the telephone. Right now, this little thing is like a library itself. And as a professional, you can have information for yourself or to give to another professionals, right? Including the pharmacist. And as a patient, when you have symptoms of any kind, or when you use any kind of treatment, you will have to you will have doubts. So you can check in on the telephone, you can check in on your iWatch, you can have like these apps to monitoring, for example, your blood pressure. But for instance, you will need in some time to call the doctor, and I mean not only the doctor but also the pharmacist to make inquiries, to ask questions about drugs. And this year, as you all know, it has been like an earthquake plus a tsunami plus a hurricane all together, because 1 year ago it was not even thinking about it, about the COVID-19, right? And the problem with this, the problem is that all the world is impacted by this virus, and we have made a lot of progress, but we didn't have yet a vaccine or even a real treatment for the COVID-19. We have a lot of information, tons of information on the newsletters, on the news, on the TV, also in Netflix, in all the platforms, and all the Facebook, Instagram, TikTok, everything. We have information about the symptoms of the coronavirus. As you can remember, like fever, chills, loss of taste or smell, that was a new symptom around April or May, vomiting or diarrhea, muscle or body aches, and of course the typical around a flu, like cough, difficulty in breathing. And for example, this information that is from the CDC in the United States say very clear that you have to seek immediately attention if you have one of those symptoms, so they can treat you as well as can be. We also have many information about how to prevent the disease. The main one, as you all know, is by washing your hands with soap and water, and perhaps use alcohol in gel after the washing hands, and for at least 20 seconds. And you know, well, in Costa Rica, we said that we need to wash the hands the time you run the happy birthday song. So perhaps one time or two times, but that's one of the principal prevention methods. Of course, avoiding touching your eyes, nose, and mouth, and avoid close contact with people who are sick. But later, they say to us, all the resources, please wear a cloth face that covers your nose and your mouth to prevent interaction with other people. And also, please keep away the distance, keep the social distancing about 6 feet or 2 meters. And it's important to do that. And meanwhile, everything that was happening, all the information was getting to us by several medias. Also, the countries has, we have saw a lot of people dying, the hospital with no capacity to attend all the people, and also like a social and economic crisis in different places. So it's kind of cataclysm. That's what I'm saying. An earthquake plus a hurricane plus a tsunami is like a lot of things to manage in just 1 year. And the thing is that right now we don't have a specific treatment that's kind, for example, the heparin and dexamethasone, some of the medications we can use, but right now we don't have a treatment, a vaccine. Some years before this, I was I have this thought that the company that sells the HIV vaccine will have the biggest success, but right now is the one that has the COVID-19 vaccine. So we have seen a lot of information. For example, this one, there are, of course, of good quality, like the one in the WHO webpage, for example, this one. And I love this timeline because it gives you like this whole thing perspective. So what has been the major issues in each region? So as you can see, you can find for all the regions, Western Pacific, Southeast Asia, the Americas, Europe, Eastern Mediterranean, and Africa. So each one of these dots has information. So you have just to click it, and then you can see the info. For example, in this print screen, we can see, for example, this one in February, that the WHO convened a global research and innovation forum of the novel coronavirus. So as you can see, has been many actions during the time. Okay, they also have these short videos. For example, oh my God, so sorry. For example, to teach the people how to break the chain of transmission, or how to wear a fabric mask so you can do it properly, and also how to remove it. Okay. One of the things I like the most from the WHO webpage is that you have the information in several languages. You have in English, in Francais, you have it also in Arabic, in Spanish, in Portuguese. So you can have the information at the moment you need it for the population you need it. So in this case, it's just a print screens of the information in Francais, in French. Another good resources is the Johns Hopkins University map. This was from yesterday, and we have more than 40 million cases. And as you can see on the left side, these top 5 countries with the most cases is one of the top 10 nobody wants to be around, right? So for example, you can see yesterday the first place was United States, then India, then Brazil, Russia, Argentina, Spain, Colombia, France, Peru, Mexico, United Kingdom, South Africa, Iran, Chile, Iraq, Italy, and the list goes on and on and on. So you can see, well, almost all the continent have problems, all the world have problems, and this is like a real-time data, and it gives you like the real stuff that you can see even for your own country, how is the thing developing. Another source of information is the CDC, the Center for Disease Control and Prevention, and they also have information in English and Spanish because many people in the United States speak Spanish, and they have like this huge amount of information. For example, with the symptoms, how to do if you need to travel, although the best way to protect is not traveling right now. But you have all the information like in simple language, so you can understand the meaning of all the words that it's not technical, right? We also have the European Center for Disease Prevention and Control. And here, well, you have also like a big stuff about the COVID-19 pandemic. And one of the things I found yesterday when I was looking for the information is this technical report that gave us like the control measures for primary care, including pharmacies, for prevention of the COVID. So for example, it says that you have to train all your staff so they can know the hand hygiene practice, the respiratory hygiene practice, the use of PPE, the physical distancing guidelines, the cleaning and disinfection practice that are more than ever important, the symptoms of the COVID-19, and the guidelines for self-isolation when you have symptoms of the disease. And this is like general for all the practitioners. But for example, in pharmacies, there are like specific tips that we can go by. For example, in the pharmacy, consider installing glass or plastic panels at the ones you can see at the supermarkets to protect the staff and the public, the patients, for respiratory droplets. You can see also putting signs at the entrance of the pharmacy so they can remember to wash their hands, to use the mask, for example, to keep the distance. And of course, the thing that the pharmacy staff has to wear a medical face mask. And for the customers, also you can put signs about the distance, the 6 feet or 2 meters. Also, for example, if they had some symptoms, what they can do, or for example, the one I told you before, the face mask. So this is like customized for pharmacies or for pharmacy. And for example, for the home delivery of medicines, they say that a simple process of other medicines can be used. Perhaps if they require a prescription, the patients can transfer digitally the prescriptions. Or for example, before delivering, we have to check if there's someone else in the family that could receive the medicines. Or for example, the physical distance that should be maintained when the person delivers the medicines to the patient's house. Another center or resource is the African Center for Disease Control and Prevention. For example, this is a screenshot from yesterday, the coronavirus disease and how it's presenting in Africa. And also have like a little infographic, a little image about the best health practices. Of course, the hand washing, the vaccines, and the utility of the influenza vaccine. And I also like that the information is in several languages. The one, of course, is in French. So it can be like, available for different patients in different countries. Talking about one of the, I think the most prestigious journals is the New England Medicine of Journal. and you have to pay to access for the articles. But in the case of COVID, all of the articles are free available, and I think that's good enough. The last ones about COVID has been well, the essays about the vaccines. For example, this one is for the last week, October 15, another one from September 29th, another one from September 2nd, and another one from July. So you can see right now, the principal journals are focused on the vaccine development. And I found this review from May that talks about the severe COVID-19, and it can show you how fast is information changing. So we need to be in this, like, starting every day or at least every week to see the new information, so we can give the right information in the Drug Information Center for other professionals and also for the patients. For example, in this review, you can see that the symptoms do not include the changes in taste or smelling, because it was not yet a symptom. And for example, you can see that has like a medium range of the onset of the symptoms, and right now you can see that it's between 2 and 14, so this kind of steady information. But for example, this kind of image, I mean, when you saw that picture, you think about it's better to prevent that to be in a hospital with an intubation and knowing that you have problems to breathe. So, I mean, all the people have seen perhaps this picture or something like that, but we need to be more aggressive in the information we're giving, because right now the number of cases are not slowing down, are still increasing. So we need to be sure of that. And that table is one of, I want to point out some information that, for example, in May, we were talking about this kind of medications that are not primarily for COVID-19. For example, the first two ones are for malaria, the third one is for HIV, and the last one that has been like the one with more information for COVID-19. So the thing is that the medicines are changing. And for example, well, we have also the convalescent plasma. In fact, in Costa Rica, we are doing that, and also producing a new one from kin serum. And also these ones, like the BTK inhibitors. So that's the information in May. We also have the FDA, the Food and Drug Administration webpage. And of course, we have this whole section for coronavirus, of course, about medicines and resource for health professionals. And for example, in vaccines, right now, it says that currently there is no FDA approved or authorized vaccine for the prevention of COVID. And we are committing to expect this development, but not at the expense of sound science and decision making. We will not jeopardize the public trust in our science-based independent review of this or any vaccines. There's too much at stake, and I think that's crucial. We have to do the things right. I mean, this is a sprint, but also you have to do it like step by step. Also, you have information for the NICE, the National Institute for Health and Care Excellence in the UK, and you can find also the information about coronavirus. And as I told you before, the information is changing daily. I mean, in these 10 months, the whole thing has been changed. Our life has been changed. The way that we interact with other people, the way we learn, the way we teach has been completely changed. I mean, if 1 year ago someone asked me if the laboratories of the pharmacy teaching could be done at home, of course, my answer will be no, of course no. But right now, we are giving all the best to adapt to this situation. So that's where the Drug Information Center come in, because as I told you before, not many people has the time or the skills to read and process all the information that is in the books, in the articles, or in the databases. So I will show you some experience about the Drug Information Center around the world, and I will finally get to my Drug Information Center in Costa Rica so I can tell you some of the things we have done in these past 10 months. This one is from Egypt. You can see the website. And for example, they have this medication monitoring tool that give you the opportunity to see the contraindications, if you can give the medication in pregnancy or in pediatric patients, in child, and also the things you have to be focused on, for example, the elevation of ACT or ALT or the Q2 period, so you can find that information in there. They also have the information for these other medications like azithromycin, corticosteroids, tocilizumab, ribavirin, doxycycline, etc. We have this one, another part of the world, the Medicine Information Center in Cape Town. As you can see, they have like the resources, the links, so sorry, for another, oh my God, sorry, for another websites. And of course, they also have, for example, this information about one of the medicines for severe COVID-19. This one I like very much. Of course, it's in Spanish, but it's in Spain, it's in Granada. It's called Cadime, the Andalusia Drug Information Center. And they have also this statement about the treatment. So sorry, information is in Spanish. So they have like these preliminary results for the treatment used in Spain to treat the COVID-19. This one is from Colombia, the Drug Information Center, the University of Colombia. So they have, I mean, like these videos that give you information how to prepare to fight against the coronavirus. For example, that one with the pharmacist is explaining how to use the mask. And as you can see, there are videos of maximum 5 minutes. So it's very common to give information for the patients. We have this another one from Chile, the Drug Information Center and Pharmacovigilance Center of the National Health Ministry of Chile. And they have, of course, information like the articles that can give you, I mean, the links that can give you the articles about they're talking about. And for example, this one is from Argentina, from the University of Cordoba. And you can find here one of the most important studies right now, that is the Solidarity study. And you have right now in the screen the abstract in Spanish, also this in Spanish, and saying that is a preprint that is not available or is not being reviewed by peers. And here's the same thing, but in English. So you have the information if you want to dig more in it, okay? And finally, I'm going to talk to you about our experience in the National Drug Information Center, CIMED for his name by Spanish, that is Centro Nacional de Información de Medicamentos, who is located in the Pharmaceutical Research Institute at the Pharmacy Faculty of the University of Costa Rica. So in this 10 months, well, past 8 months, since we closed the doors, so right now we are working in everyone's home. We have attended inquiries about COVID treatment by telephone, by email, by WhatsApp, by Facebook. Also, we have collaborate doing a technical document about chlorine dioxide because that's a popular thing that people is using too and has the danger of poisoning. We have also developed patient infographics, TV and radio interviews, lectures for patients, once or two for each month. We are fighting against fake news. We are doing also pharmacovigilance actions. We have this collaboration with the Red Sim Lab, that is the network of the Drug Information Center for Latin America and Caribbean. The COLFAR, that is our Pharmaceutical Association, and CNA is the Poison Information Center for Costa Rica. And of course, the support to the INIFAR, that is the institute, as I told you before. Some of the inquiries has been around these medicines, for example, albendazole, azithromycin, colchicine, dexamethasone, remdesivir, zinc, vitamin C, just for mention a few. And for example, these one are like infographics made for the patients with a warning not to take products with chlorine, and that the regional office of the WHO, that is OPS, is telling you that there's no need to take these kind of products and that you have to be aware of the poisoning. And this one, that is like the technical report, we did like 2 months ago. Let's see. We also launched the WhatsApp service for inquiries that we don't have it before. We do it right now in the middle of the pandemic. This is also, oh my God, so sorry. This is also a leaflet just telling the people that if you need to go to the pharmacy because you have diabetes, hypertension, or some respiratory diseases, you don't have to go. You can ask for a family member to go and to see for your medicines at the pharmacy. This was also a collaboration that we have with the network I told you before, that it was a special issue for COVID-19. And as you can see on your left, there's the list of the countries that belong to this network. Costa Rica is one of them. So is the National Drug Information Center it belongs to. And for example, we try to do like a review or all the fake news that were on the web, or the people were asking us, just to make sure to inform the right information and not to believe in the fake news. So for example, these two, the first one is, can I eat garlic in any presentation to prevent the infection with the coronavirus? And the answer is no. The garlic is a healthy food that has some antimicrobial property, but there's no scientific evidence that show us that can protect against COVID-19. Or the second one, the one in yellow that says, drink it hot water prevents the infection for the new coronavirus. No, the answer is no. Taking hot water has not information by preventing the infection. It do not also eliminate the germs. So you have to be also taking with precaution, because you can have like injuries in your mouth. Okay. And for example, in our university, the institute has developed the first tablets of a possible medicine against COVID. That was the favipiravir. And we also have like this arrangement with an industry to develop one that is given by intravenous vein, that is the remdesivir. So for this lecture, one of the students helped us like doing this huge review that it's important to talk about just at the end of the presentation. And he has researched a lot of information just for these 10 slides, more than 15 reference, of course, of this year. And for example, we're going to talk about one of each the treatments that we have in this review. For example, the plasma, the convalescent plasma, that is like the passive immunity, has been watched that, oh, I'm sorry, that has property, let's see, I'm sorry, but the computer is just thinking, thank you, that has property to neutralize antibodies. So right now is an FDA-approved therapeutic option for patients with COVID-19. And on your right, you can see some clinical outcomes that may help for the authority to make decisions if they're going to use or not this convalescent plasma. Another information is about alpha interferon, that has a broad spectrum antiviral agent. And in addition to glucocorticoid therapy, has been resulted in 50% reduction in time to lung image remission, as well as oxygen saturation improvement. So in the hospital, hospitalized patients can be a good one option. This one also, the tocilizumab, well, has potential to benefit the COVID-19 patients. Or this one, the umifenovir, that is not approved yet by FDA, but it's used to treat influenza in China and in Russia, and currently is on clinical studies against COVID-19. The Kaletra for the HIV, lopinavir plus ritonavir, has been, limits the propagation of the SARS-CoV-2 infected cells. And as you can see, there's a lot of registered studies for this combination alone or with other drugs. In fact, 53 students right now in this field. Also, we have remdesivir, that is the one that we are producing in our faculty along with an industry. Right now we have like around the world 21 trials starting this drug, and the FDA approves on May this year, like as an emergency treatment against the COVID. We also have favipiravir, also known as avifavir, that is a drug of a purine, and has been approved in Japan 6 years ago for influenza treatment, and right now it is currently under investigation, and is the first COVID-19 specific treatment approved in China. We have, of course, the dexamethasone, that we have this recovery study published in July 2020 that has been associated with a significant decrease in mortality. We also have the chloroquine and hydroxychloroquine that potentially could inhibit the entry of the virus. We also have one antibiotic, azithromycin, that can be useful. And you can see on the right side it says, because azithromycin is currently the most commonly prescribed outpatient therapy for COVID-19, establishing whatever is helpful earlier in this disease course is an important research or priority. Just to give you an example, in Latin America, right now Honduras has this treatment they call maize, and the name of maize, that is the same that to say in English corn, is for the initials of these medications, microdacin, azithromycin, ivermectin, and zinc. Some of them has informations, some of them is further investigation. In the first case, microdacin has positive and negative information, but it's something that the system in Honduras is right now using. So they give this treatment and then follow by catracho treatment. That is colchicine, tocilizumab, ivermectin, anticoagulants, and hydroxychloroquine. So as you can see right now, we don't have a lot of information, but we have to stay on the road. And this picture just helped me representing that we have two things. We have to be fast and faster every time, like the rabbit, so we can find finally the treatment and the vaccine. But also we have to be like in a marathon, like a turtle, because you have to do the things step by step. I mean, fast but also slow.
Our first question is, someone is asking if Ms. Hall could repeat the main resources to refer to in our studies.
Yeah, of course. I mean, the main resources are, for example, WHO, the FDA, the EMA webpage. I'm sorry. Okay, so those are one of the best ones. So you can like get information for deliver for the patients. Also the CDC, perhaps I can give you a list with the links, and the IPSF can give you the information by email. I don't know if it's something that could be done or not.
Okay. The second question is, do all types of masks protect us from the coronavirus?
I mean, they have to be like 3 layers so they can protect you. I mean, we can use the one that is used in the hospitals, for our community settings, but we need this one that can be with 3 layers and also changing every 4 or 6 hours. So has not the humidity that we expel when we talk. So I think that's the good way. I mean, like there's a shortage of the medical protection equipment. Perhaps you can use the ones made by I mean by you using the gloves. I'm not using that in English. Like handmade mixed masks or the one that is being sent in supermarkets, but not the chirurgical one, the one that is used in the hospital, because kind of tricky to obtain.
Ms. Hall, I think you're facing a technical difficulty. We can't really hear you.
Are you hearing me right now?
There's a slight
Okay.
glitch. Maybe try disconnecting and reconnecting your microphone.
Is it better now?
No.
There's like a loud sound in the background.
Yeah, there's like a background noise.
Right now?
Okay.
It's better?
Yeah, now it's better. Yeah. Okay.
Perfect.
Good.
Okay.
Okay. So our third question is, how far along are the COVID-19 vaccine clinical trials for various pharmaceutical companies, i.e. the AstraZeneca Oxford University COVID-19 vaccine?
Okay, as I know, it has been like 4 months that they're doing the trials, but as you all know, a vaccine trial, and I mean from the beginning of the trial to see the vaccine already in the market has to be at least 18 months. So we are now like waiting for the month to go, right?
Okay.
So sorry for the background sound, but there's all my puppies.
It's okay. Another great question is, can you contract COVID-19 twice?
Yeah, in fact, last August, the BBC reports that we have a reinfection in Hong Kong, in the Netherlands, and in Belgium, so sorry, and that is indeed necessary to make like more studies to see if we have like a mutation or is exactly the same virus that has been the second infection. But yes, you can reinfect it with the COVID-19.
Interesting. Okay. So another question is, what inspired the creation of this webinar?
I think that's one for you, right? The IPSF.
Yeah, I think Joy or Trisha, would anyone would like to take the floor?
Trisha?
Hello, everyone. I think it was just seeing how much misinformation that was out there. Can you hear me, by the way? Sorry.
Yeah.
Yeah. Just how much misinformation that was out there, and thank you, by the way, for such an amazing presentation as well. And just the importance of as future healthcare professionals and current healthcare professionals being in that position to be able to educate patients and be able to tell them, educate them on the many misconceptions about COVID-19 that were out there initially. So I think that was what inspired our choice of the topic for this webinar. Joy, did you want to add anything?
Yeah, so we were inspired to create this webinar through just the current situation that we're in. We thought it would be a nice opportunity to be able to educate people on, news around coronavirus and just try and debunk the typical myths that we're seeing around the internet as we face not only like a pandemic, but we also face an infodemic of false information. So we thought it would be a nice opportunity for people to learn more about the virus and where they can access reliable information.
Thank you, guys. I think you've answered it beautifully. That is exactly why we were inspired to create this webinar, and hopefully you guys have benefited from it. Moving on to our next question. Do you think that this pandemic has been politicized, i.e. in the USA?
I mean, I think it has been mixed with politics all around the world, not only USA. I mean, there's like this. I'm so sorry. There's like this running for having the treatment and the vaccine. There's also like giving the population the certainty that the government is doing the right thing for the protection. So I think it's like, it's not exactly the same, but kind of the well, you're too young, but well, I was not born yet in that place, but when we have the Cold War, there's like this running for giving the men into the moon. Right now, it's exactly the same. It's like 100 meters career, like a sprint. So that's the thing. And another thing that is involved with politics is the unemployed people and the lack of resources to attend everyone at the hospital. So I think that's the main issue, that it is not only a sanitary or health crisis, but it's also an economic and social crisis, not only for the USA, but for all the countries.
All right, thank you. Oh, this is a great question. We have been receiving news about reinfection over the media, but no one clearly answered if people can get reinfected with COVID-19 even after recovering.
No. As I mentioned before, we have news about people that has COVID, then recover, and then go and infect it again. In the three places I mentioned before, the Netherlands, Belgium, and Hong Kong. So the thing is that we don't have any information about how long is the immunity. So yeah, right now we have this problem. Yep. And this is an important issue for the development of the vaccine. Because as you remember, the vaccine, for example, for dengue, has been approved only for the people who has had the disease before. So we don't know if the vaccine for this will be for the naive patients or just for the patient who were infected once and to prevent the second one. So it's like a good question and a good information for the vaccine resources.
Okay. Someone is asking if you could recap the COVID-19 medications.
Yeah, of course. I mean, remember that we don't have yet a specific one, but seeing the other question that comes along, perhaps the two that has more potential could be Favipiravir and Remdesivir. Has been like the ones that are being used in other countries, like Russia and China, and that has been one of them approved by the FDA. So could be interesting or perhaps with the more potential. The thing between one and the one and another is that, for example, Favipiravir you can take in orally by mouth, and the other one, Remdesivir, you have to administer it by syringe. I mean, like a parenteral way. So that's kind of different, and perhaps it could be one for patients inside the hospital and another one from the patients outside the hospital. But right now, this is all being starting. Has not been nothing approved yet. Yeah, I mean, as I told you, the FDA approves the remdesivir as an emergency treatment, but we are expecting more information.
Okay. Okay, someone was asking how long can we have immunity after being infected with COVID-19?
We have no information yet. That's the thing with this disease, that we are all learning in the process. I mean, we know much more right now than 6 months ago, but it's not concluded. So there's some questions I have not yet the answer. Yeah.
it's a very tricky
Yeah.
disease. Okay. What happens when someone gets COVID for a second or a third time? Does that become more severe each time someone gets infected?
We have not the information yet. For example, as I told you in dengue, you know that the second or the third time, it's more likely that you get dengue complicated with some hemorrhagic manifestation symptoms. But in this case, we have not yet the information.
All right. Okay. Someone is saying that how is it possible to have a vaccine anytime soon when an average vaccine needs around 10 to 15 years to be released?
I mean, usually the vaccines need 18 months to develop, at least 18 months. But you know, there's also the political stuff and the resources stuff around the developing of a vaccine or for example, the treatment. Just to make sure, for example, we have the tuberculosis vaccine since 70 years ago, and we have no interest on researching a new one. I mean, the one that is already, it's good enough, and that's kind of thing. But in this case, the COVID is affecting all around the world. So all the G20, G8 countries are focused on that because has been many diseases, deaths. I'm sorry. So that's something about science, and also political and money issues.
Yeah. Okay, due to time, we're running short of time. We will be answering one more question, so I'm going to be picking randomly. Okay. Are there any signs that the virus is losing its potency, or do all strains have the same potency?
There's no information yet. I mean, the genome was discovered, I think, April or May, and they're just doing studies. But the thing is that the number of cases you're seeing in the map, in the Johns Hopkins map, is not going down, is going up and up and up. And I mean, for example, in Europe right now, there's like the second wave of the disease, and for example, in Latin America, we are just, I think, facing and not getting off the first wave. So that's an issue we have to learn how to live with. So right now we have no information about the virus losing their potency, but the thing is that we need to get more aggressive with the population, with the prevention, because you see all around the world people making TikTok and Facebook videos that they are having like parties at the beaches or parties on a pub, and it's not quite good. I mean, right now you have to maintain your bubble, like your family, and not get out if it's not completely necessary. I don't know if you guys are having the lessons, the classes of the university at your home, or you're going right now to university. But for example, in Costa Rica, all this year has been in home. So this is the message. You have to be more aggressive with the people. Do not stop the prevention measures. It's not quite yet over, so we have to be like focused on this every day.
Thank you so much, Ms. Hall, for taking the time to answer all of the questions. We will now be concluding our Q&A sessions. Please feel free to take the time to fill in the short evaluation form that we have provided in the chat box. And thank you so much, guys, for tuning in. And once again, thank you again, Ms. Victoria Hall, for this webinar.
No, thanks to you for the opportunity. I hope I can contribute with a little more information and for our experience. And thanks a lot. I'm honored to contribute with this.
Our pleasure. Joy, Tricia, would you guys like to add anything?
Yeah, yeah, thank you guys for attending this webinar. We hope you were able to learn something new. And if not, if you weren't able to learn something new for yourself, then at least hopefully you can refer people to the useful resources that Professor Hall has provided. And for those of you who work in the pharmacy, I'm sure these resources will also be really useful for you. And yeah, thank you for joining.
Yeah, I would just like to echo what Elamise and Joy have said. Thank you so much, Ms. Hall, for taking the time, and thank you for everyone for attending. Hope you've gone away with some new knowledge, and we look forward to attending more webinars in the future.
Okay. Bye-bye, everyone. Thank you a lot.